Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. If you're watching this video, I'm quite sure about something. You maybe visited your doctor for a routine health visit and something got flagged about your kidneys. That's right. This test, the Urine Albumin-Creatinine Ratio or the Urine ACR test, is targeted to check how well your kidneys are working. It's possible that your doctor has noticed something wrong with the way you look. Maybe your face is very puffy, you have swelling on your body, or you feel very tired. It's equally possible that you're a diabetic patient, you have diabetes, or maybe you have high blood pressure. Whatever the case may be, you may have seen the word albumin, urine, or protein somewhere in your case notes. Maybe your doctor told you that you need to get this test and that's why you're here looking for information. Well, you don't need to worry. I'm going to tell you everything you need to know about this test. What it is, who should do it, why it matters, and when you should really get worried about the results. So stick with me throughout this video. Here's the key thing that you need to understand about this test. Your kidneys, the thing that we are targeting in this test, are the filters of your body. Their job is to filter out all the waste products and all the harmful stuff from your blood and pass it into your urine. At the same time, they also do another critical thing. They keep all the good stuff, maintain it inside the blood. They don't allow it to be lost in your urine. So the kidneys are actually two things that are being done by just one organ. It keeps in all the good stuff and it lets go of all the harmful and the waste stuff into your urine. Now, one of the most important things that your kidneys have to keep inside your blood is something called the albumin. The albumin, which is the same thing that you find in egg protein, in the egg white, is a protein that is critical to maintaining your blood pressure and a whole host of other functions in your body. Normally, the albumin should not be lost through your urine. There is no role of albumin in your urine. It should not be found in your urine at all, and your kidneys are supposed to keep all your albumin inside your blood. But if something goes wrong with your kidneys, if they're damaged even a little bit, tiny little micro quantities of this albumin starts leaking out into your urine. And this test is also called an early marker of kidney damage. And why is it called early? Because it tells us very early on, far before you notice any symptoms, and very early in the stage of kidney damage, so that we can find the problem and treat it early. It's one of the best tests that I personally think has ever been invented in medicine, because it's totally painless, it's done on your urine, and it tells us years before something goes actually badly wrong with your kidneys. That's why I think this is a very important test that not only people with diabetes and blood pressure, but everyone should know about and get done at least once after they cross a certain age. So who does this test really matter to? So like I said, anybody above the age of 45 or 50 should consider getting this test done at least once in their lives. But more focused are people with diabetes type 1 and 2. This is because diabetics are at a very high chance of getting impacted, especially at their kidneys. The sugar in the blood, which goes above normal in people with diabetes, damages the kidneys and causes all kinds of structural changes in the tiny vessels, not only in the kidneys but also in several places in your body. So if you have diabetes, this is one of the most important tests that you should be doing, because it can tell you whether your diabetes is actually affecting your kidneys or not. Number two, people who have high blood pressure. The reason here is the same. The increased pressure in your blood also damages the tiny little structures in your kidney and can then cause them to start leaking out albumin into your urine. And that's why this is very important for people who have high blood pressure, especially for a long period of time. This test should be done. Other than this, if you have any family history of a kidney disease, there are many types of kidney diseases which are found, which are familial in origin, and people with those kind of diseases should also consider getting this test done. Lastly, if your general practitioner or your doctor has flagged you for some reason to be a person who might be suspected of kidney damage, then this test is absolutely essential. So if you have symptoms like swollen ankles, foamy urine, or maybe a puffy face, you're going to have to consider getting this Urine ACR test done, or the Urine Albumin-Creatinine Ratio test. And now we're going to get into the details and the specifics of the test. So what is this test? To get to the point, this is a simple urine test. That means you have to provide a single sample of your urine. The lab will process that sample and provide you with a result. Now, what does this test really even measure? So, as I've already been telling you, there is a protein in your blood called albumin, and this is a very important protein for your health. Normally, your kidneys make sure that this protein stays in your blood and doesn't leak out into your urine. When your kidneys are not working properly, it instead does leak out into your urine, and that's what we measure in this test. But there's another part to this test called the urinary creatinine. Now, creatinine is the waste product of protein metabolism. That means that it has no real value to your body and it needs to be filtered out completely into the urine. Why do we measure both these things in this test? Why not just measure the albumin alone? The reason for this is that the albumin varies from person to person. If you provide a single urine sample, the amount of albumin in that sample may be different depending on the time of the day, your weight, your age, your ethnicity, and a whole host of other factors. But if we take not only the measurement of the albumin as well as that of the creatinine, we can measure how much albumin is being lost relative to the amount of creatinine also present in that sample. How this helps is that the creatinine that is lost is normally constant for most people. All of us tend to lose the same amount of creatinine per unit time because it is a measurement of your protein waste or the protein metabolism. And that is why it's more useful to measure how much albumin is being lost relative to how much creatinine is lost instead of just directly measuring how much albumin is lost. This allows us to do this test on a single urine sample without you having to collect your urine for the entire day. The ratio makes it possible for us to compare you with known normals irrespective of your weight, height, age, gender, and other variables. So the ratio is the reason why this test is so effective, why it can be done on a single sample, because we are actually measuring how much albumin is lost relative to a known constant. That is why the test measures the amount of albumin in the urine sample as well as the amount of creatinine, and then gives us a ratio of the two, which is the amount of albumin divided by the amount of creatinine. And this is then compared to known normals. That is why it is called the ACR or the albumin-creatinine ratio test. So when do doctors advise this test? I've already told you a lot about this in the beginning of the video, but there are just three main reasons. One is the monitoring of patients who have diabetes for a long time. Diabetics tend to have kidney damage, and this test helps us to detect it very early on. It's the same thing with people who have a high blood pressure. High blood pressure damages the kidneys and causes this albumin to leak out into the urine, and so this test is very helpful. And thirdly, if you have any other known kidney disease, there are many diseases of the kidney other than those caused by diabetes and blood pressure, and this test helps us to know the extent of kidney damage. So all in all, it's a test to check how much your kidneys are already damaged or how early we can catch that damage and then go ahead to treat it. So what are some of the symptoms? Here is a detailed but rather still incomplete list. So you have things like you might notice foamy urine, frothy urine. When you pass your urine into the toilet, you notice a lot of froth or foam on the top. This could be because there are too many proteins or albumin in that urine. You might have other non-specific symptoms like swelling on your face or your feet. You feel very tired, you lost your appetite, you experience unexplained itching. There are a whole host of symptoms that are quite hard to pinpoint to a particular cause, but all of these actually originate from the poor functioning of your kidneys and or the lost proteins. Why do these patients have swelling on the body? Well, that is because the proteins in the blood normally help to keep water also inside the blood. The proteins have an effect like an osmotic effect where they tend to hold water as well. Now, if the amount of proteins in your blood starts to drop, the water starts flowing out into your tissues. It gets under your skin, it gets under your feet, under the skin of your feet, and that's why we see this swelling. So do check out all the symptoms in this list. So how do we prepare for this test and how is this test done? Well, as I've told you, it's a simple urine test. You can provide the sample at any time of the day. It doesn't have to be in the morning, but most labs will request you to provide your first morning sample. You have to remember that for at least a day before the test, try not to consume too much meat and do any kind of very heavy or strenuous exercise like running in a marathon, because this tends to elevate the amount of creatinine in your urine way above normal. Other than this, there are no special precautions. We just need around 20 ml of urine to perform this test. You will be provided with a sterile container. Just urinate into that, provide that container to the lab, and they will take care of the rest. You'll have the result probably on the same day or maybe early the next day. The results are measured in a ratio called milligram per gram, and I will tell you the normal ranges in the next couple of slides, but this is all you need to know. It's a simple urine test. There's nothing special about it. So what is the normal range for this test? Well, in most patients, men and women, the normal range is expected to be below 25 or around 30 milligram per grams. That's the normal expected value. Anything between say 30 to 300 is considered to be an early warning sign. That means there is a little bit of albumin leaking out into the urine. It's not still a lot, but it can be detected. It has been detected. And so 30 to 300 is sometimes referred to as microalbuminuria, where there is very little, very minor quantities of albumin which are leaking out into the urine. And that is the stage at which the disease is still reversible. We can definitely try to tackle it with medications and changing of your lifestyle. And so this is very important. If your value is between 30 and 300, you definitely need to look for treatment for your kidney and actually control the underlying cause, which could be something like diabetes or blood pressure. Anything above 300 is called overt proteinuria. That means there is a significant amount of albumin leaking out into your urine. In fact, at this stage, if you went in for a routine urine test, it will even show as positive for proteins on that test. So anything more than 300, that means there's already a lot of proteins leaking out into your urine. It's not a good sign. You definitely need to visit the doctor and consider treatment. What do higher than normal results mean? Well, you probably already guessed this. It means that your diabetes has affected your kidneys. Your kidneys are damaged. They're leaking protein into your urine. That's the basic underlying meaning of an abnormally high result. Number two, it could also mean kidney damage from high blood pressure. The elevated blood pressure has caused microscopic trauma or injury to the tiny little blood vessels in your kidney, and this is causing leakage of proteins into your urine. Other than this, you also have a higher risk of heart disease. Most of the times, patients with diabetes and blood pressure who have kidney damage also tend to have other significant signs of these diseases, like heart attacks, heart diseases. There are all kinds of other problems. You might have problems with your vision, as well as with your lungs. There are many other things that could have happened by this stage, so you need to watch out for all those as well.